Many patients think every anal problem has piles, but piles, fissure and fistula completely different conditions with different presenting symptoms and treatment options. These are among the most common diseases which affect the adults. And the good news is every condition can be treated effectively when diagnosed early. Coming to piles. Piles are nothing but swollen veins which are present around the anus. They usually present with bleeding during passing stools, and it can also be associated with itching around the anus, and sometimes patients complains of mass in the anus after passing motion. It is not associated with pain unless it is complicated with conditions such as infection or thrombosis. Coming to next condition, fissure. Fissure is tear in the anal region. It is usually associated with constipation. The main symptom in fissure is pain, and there can be a small amount of blood in stool, and it is usually caused because of excessive straining during defecation. In this condition, pain is a dominant feature which can be associated with constipation or sometimes increased frequency of stool as well. Next condition, that is fistula. Fistula is nothing but an abnormal communication or such a thing like a tunnel between the anal canal and the outside skin. The most common symptom in fistula in anus is recurrent discharge associated with foul smell. It can also sometimes present with bleeding or pain in the anal region. Patient can also give histories of recurrent boils or swellings around the anal region. Sometimes patient may present with wetting of the inner garments as the only symptom. In this condition, recurrent discharge and infections of the anal region is the dominant symptom. So if we compare all the three conditions, the commonest symptom or the dominant symptom of these three are for piles, bleeding per annum, for fissure, pain during defecation, and fistula, pus discharge around the anal region. Important signs when you need to immediately consult a doctor such as persistent bleeding per rectum, weight loss, fever, elderly adults more than 45 years who have bleeding symptoms, and anemia, that is less amount of blood in the body, swellings around the anal region, bleeding associated with fevers. In such condition, you should immediately consult a doctor. Not all bleeding is piles, but sometimes some serious conditions can also mimic as piles. Coming to the treatment options, surgery is not always the only treatment options. Initial symptoms can be treated with only medications, or more importantly, lifestyle modifications, which is very much important in these three conditions as well. And as well as coming with the recent modern treatment options such as laser surgeries and minimal invasive procedures, the recovery options are very much better. Finally, I would like to conclude by saying, do not suffer in embarrassment. Early treatment leads to faster recovery and quicker recovery. Thank you.